mission for its work in diabetes. Motivated by personal health care and a commitment to transforming lives, he combines clinical insight with practical strategies to help patients achieve genuine and lasting change. Today, he brings us valuable insights into a very important question: is type 2 diabetes reversible? Please join me in welcoming Dr. Andrew Chiew.
Remote. 12 years ago, in 2013, I met a patient by the name of Andy. Ini tak jalan ni. Is this working? It's not. Is it moving? Yes. Oh, alright. Okay. Okay, let me try again. Yeah, it's coming. Okay, good. So Andy was 28 years old and he presented with a dull, aching abdominal pain. Alongside with that, he also presented with tea-colored urine for about 1 month. So we proceeded with a few imaging investigations, which included ultrasound abdomen, MRI, as well as CT scans. And this is what they found. They found a growth that is as big as a ping pong ball. Thank God it was not pickleball, seated at the head of the pancreas. So it's 4 centimeters in diameter. And at the point of time, the attending surgeon offered an operation. And that operation could potentially be a what? Can anyone tell me? What could it be? Starts with W. That's right. It could potentially be a Whipper's procedure depending on what the surgeon see on the table. So do you think Andy went for the operation? No, yes. So Andy was like, okay, how can I, being 28 years old, diagnosed with potentially a pancreatic cancer, and I have to undergo a Whipper's procedure now? So he insisted to be referred, and he was then referred to Selayang Hospital. We all know that Selayang Hospital is the hepatobiliary center, right? So in Selayang Hospital, what was done to him was a scope, right, whereby they inserted the scope through the mouth, went all the way in, and they took out some sample for biopsy. And you know what they found? They realized that it was a granuloma. It was not even a tumor to begin with, so it was not benign, it was not malignant, it was an infection. And to be more specific, it was an abdominal TB. So therefore, Andy escaped the operation, Andy escaped the chemotherapy, radiotherapy, whatever that comes with it. So he ended up with 6 months of anti-TB. Question: who do you think is Andy? Yes, alright, me. I was Andy. This happened to me back in 2013. So, alamak, now you know my age, right? Yeah. And what do I, as a doctor, learn from this lesson? I told myself, moving forward, no matter what I do, the moral of the story that I got from this near-death experience is, I told myself that I have to find and treat the root cause of diseases. And this is how I started my own practice, Clinic Zero. Clap, clap. This is going to lay the foundation of what I'm going to share with you today, which is type 2 diabetes reversible? Now, how many of you believe, okay, you may not know how to do it, but how many of you believe that type 2 diabetes can be reversed? Please raise your hand. Wow, not bad. I think we have like at least 1/3. Wow, cool, not bad. Okay, how many of you feel that reversing type 2 diabetes is a scam? Okay, no hands. Alright, so that means still got 2/3. How many of you still don't know what is going on? Yeah, most of the time there are people like this, right? Yeah, but nevertheless, we are going to find out today, yeah, whether type 2 diabetes can be reversed, so much so that they don't have to depend on lifelong medications, insulin, or supplements. Okay, let me get the formalities over first. Because I see a lot of doctors presenting, they always share this disclaimer. I initially don't really know what is it, so I asked GPT, and this is what GPT gave me. Yeah. Truth to be told, I have presented the same topic at least hundreds of times because I've done this once a week since MCO until now. But I haven't done it to more than 200 medical doctors. So I'm actually a little nervous. Alright? Okay, come. The following views and opinions are based on my own research and clinical experience. I've been practicing as a doctor for the past 15 years. I started back in 2010. This presentation is for information purposes and pure discussion only and does not constitute medical advice. Diabetes mentioned in this presentation is type 2 diabetes, meaning unless it's being mentioned otherwise, it is only type 2. That means not type 1, not type 1.5. How many of you have heard of type 1.5 diabetes before? Tak pernah kan? Go back and find. There's something called MODY. There's also something called LADA. Alright, LADA-MODY. Next, there's also type 3 diabetes. Go and find out what is that. And finally, there's also a type 4 diabetes. But for time, because of time restriction, I will only be speaking on type 2 diabetes. Let's continue. Alright, so what is the definition of diabetes reversal? Okay, just now about 1/3 of you raise your hand and say, yes, diabetes can be reversed. So now, I want to ask you, what do you mean by reversing diabetes? Okay, sorry, but because you're the closest to me and I saw you raising your hand, will you share with everyone, what do you mean by diabetes reversal? Can we have a mic to this lady, please? Yeah. Sorry, kenakan you. Yeah. Okay, what do you mean by reversing diabetes or diabetes reversal? What do you have in mind actually? Okay, can you share with us maybe your name and your practice and yeah. Can you bring your mic closer? Yes.
My name is
Dr. Masa, yes. Ceras Kuala Lumpur. Okay, yes. I'm from Ara Damansara. Dekat, yes, okay. Lifestyle modification. Oh, that's what you mean. That means tak perlu makan ubat, tak perlu injection semua tu lah. Okay, not bad. Alright, let's give Dr. Masaha, right? Yeah, a big round of applause. Okay, good. I'm pretty sure most of us know that according to the CPG guidelines, what is the first line when it comes to managing diabetes? Lifestyle, right? That's supposed to be the way, right? Yeah. Okay, so I will share with you my definition of reversing diabetes. Number 1, the HbA1c has to be lesser than 5.7%. That means even if it's 5.7%, it's still not reversed. It has to be lesser than that. So it's 5.6% or below. And the fasting blood sugar, FBS, has to be between 4 to 6 consistently. Next, the third criteria is the random blood sugar has to be between 4 to 8. And I always leave the best to the last. All this has to be achieved without medications. I'm talking about OHAs here. Without insulin and without any supplements. This is quite a big claim, right? Yeah. So we'll find out whether is this achievable or not today. So the question now is, who am I? Who am I here to talk about reversing diabetes? Okay, but what I want to say is, it's more of like, who am I not instead of who am I? Okay, so let me share with you who am I not first. Number one, I am not an endocrinologist. Is it a good sign of relief? Okay, sorry by the way, any endocrinologist here? Oh, thank God, no, tak ada, okay. Alright, secondly, I am also not a physician. Okay, so I know what some of you are thinking now. Okay lah, then no need to listen already, right? So GP is supposed to listen to specialists here, right? Coming to a GP symposium to learn, right? Yeah, I'm not a physician also. I am also not running a GP clinic. Weird? I'm not running a GP clinic. I'm a medical doctor. I'm actually a GP, but I'm not running a GP clinic. Why? Because I do not prescribe medications, insulin. So I don't need a clinic, but I do a bit of locum, a little bit only, 4 hours per week. That's all I do. All right. Finally, the last one. Buckle up, because you may fall from your seat. I am not seeing patients. What is F2F? Face to face. Then what is happening? 99% of the time, I am seeing my patients online. That's why the organization, the wellness center I run is called Clinic Zero. Zero clinic, Tara clinic. Zero medication, zero insulin, zero supplements. That's how the name come by. Alright, it's called Clinic Zero. So I'm not all this. So, question, who am I? That is for you to decide at the end of my presentation. But no matter what you decide, I have a sincere request to you. Please don't throw eggs to me, okay? Especially the rotten ones. Okay, otherwise, I think MMA, Holiday Inn, they will come after you. Is that okay? I also have another request is that I need you to be really open-minded for the next, okay? Please bear with me for the next 35 minutes. I have until 4, right? Yeah, okay. So please be open-minded. I believe this is how science can progress. Yeah, and I want to take this opportunity to thank Dr. So. Where are you? Yes, please give him a big round of applause there. I have attended this GP symposium for a few years, and you know, one day Dr. So just come to me and say, Andrew, why not you present your topic? I was like, you sure? Reversing diabetes, you know. He said, yeah, why not? Come and share your knowledge. Right? So in the end, I hesitated, but in the end, I still decided to come. And that's why all of us are able to learn from each other. Is that okay? So my purpose here is to share with you based on my experience after helping more than 2,000 patients to reverse diabetes. But how many of you realize in life, right, sometimes the more you know, you realize that the more you don't know. This is what I'm facing now also when it comes to reversing diabetes. Okay, so let's us all learn together. So, coming back to type 2 diabetes. Remember I was sharing about my life story? The root cause, right? Now, what is the root cause of type 2 diabetes? Anyone from this side? Yes? Can you shout the answer? Insulin resistance. Let's give him a big round of applause. Right, we all learn this, right? Even during our medical school, we learn that the root cause of type 2 diabetes is insulin resistance. So now I'm going to go in depth into this keyword, insulin resistance. To understand insulin resistance, let us understand what is a bacterial infection first. I want to refer to a simple one, bacterial infection of our throat. What kind of symptoms will the patient present with? One simple symptom. Fever, that's right. Okay, very good. So, symptom is fever. So what is the symptomatic treatment that we offer to the patient? Yeah, PCM, paracetamol. Simple, right? Yeah. So the symptomatic treatment with paracetamol. What is the root cause? Bacteria, that's right. Thank you so much. So the root cause is bacteria. So what is the treatment for the root cause? Antibiotics. So it's simple, right? Okay, so can we all say that in this case, for this particular patient, let's say we are so sure that it's a bacterial infection, but we did not prescribe antibiotic, we only give paracetamol. Patient may not recover or may take longer to recover. Do we all agree with this? Yes. Now, let's come back to type 2 diabetes. What is one of the symptoms? Okay, we all know that type 2 diabetes has got many symptoms, right? Okay, I'm pretty sure most of the time we diagnose a patient when we see that their blood sugar is high, right? Is high blood sugar the root cause of type 2 diabetes? No, it's not, right? It's only a symptom. It's a symptom of diabetes. Because high blood sugar is also a symptom of type 1 diabetes, correct? So the symptom for type 2 diabetes right now here is high blood sugar. What is the treatment that we are giving to the patient? Yes. You know the answer is coming, right? The OHAs that we are offering to the patient, the insulin that we are offering to the patient, the supplements that we are offering to the patient, probably not us but somebody else, they are targeting the blood sugar. Now, we come back to the root cause. Insulin resistance. How do we treat insulin resistance? This one, I need to give another analogy. For simplicity's sake, I'm going to use alcohol resistance. Alright, is that okay? Alcohol resistance. Okay, so how do someone develop alcohol resistance? When someone drink a lot or when someone drink very little? How many of you say a lot? When you drink a lot, then you get alcohol resistance. Please raise your hands. Sikitnya tangan. Do you understand my question or not? Yes, right? Okay. Okay, now let's put it the other way. Let's say I'm an alcoholic. Okay, just an example. I'm not an alcoholic, by the way. Yeah. So let's say I'm an alcoholic. I come to you. All right. I come to your clinic and I say, doctor, nowadays, right, I drink 3 cans of beer and I cannot get drunk. I feel so frustrated. I'm so sick and tired of this. So I come to you now. Then I ask you, so how can you help me? Let's say you got 2 options. Option 1, Andrew, 3 cans cannot be drunk. Okay lah, you drink 4 cans. 4 cans you'll be drunk. Problem solved lah, right? People who drink, they just want to be drunk and solve their problems, right? Okay, 4 cans. Or the second option, you're gonna ask me to say, Andrew, I think you have to slow down your consumption of your alcohol. Okay, now it's time to vote. How many of you are gonna ask me to drink more? Please raise your hands. Wow, all good doctors are here. All right, okay, yeah. How many of you are going to ask me to reduce my consumption? Please raise your hands. Okay, still not all, maybe about 1/3 only. So how many of you still don't know what is going on? As usual, right? Yeah, okay. So we all know, right? You're supposed to bring down the alcohol because too much alcohol causes alcohol resistance. How do antibiotic resistance come by? Too much antibiotics. That's why we are advised not to simply prescribe antibiotics, right? Too much of anything will cause resistance. I give you an example. How many of you here are married here? Men who are married, please raise your hand. Oh, only one. The rest of you, you don't know. You really don't. How do you enjoy life without? Okay. So married men, you all know what happens when your better half nag at you, right? The more they nag, the more resistant you become, right? Then you won't listen to them anymore, right? So it's the same. Anything that is too much causes resistance. Now, we come back to insulin resistance. What causes insulin resistance? Too much insulin or too little insulin? Too much. Think about it. It is too much insulin that is causing the insulin resistance. So if you were to prescribe any OHAs, that are to stimulate your pancreas to release more insulin, or worse still, you prescribe insulin to that type 2 diabetics, you are actually not making the patient better. You are treating the patient symptomatically. On surface, yes, wah, you punya HbA1c cantik ah. Yes, that's on surface. You are bringing down the sugar, yes. But what happens to the insulin resistance? It is getting worse. It's getting worse. The more insulin you give to the patient, the worse is the insulin resistance. That's why patient gets worse. That is why WHO defines diabetes as a chronic, progressively worsening disease. That's how it is defined. To me, it is defined this way because of the way we are treating patients, not because of the disease per se. Question: how do we treat insulin resistance now? We need lesser insulin, right? So how do we make sure that there is lesser insulin in patient's body? How? What stimulates the release of insulin? That S word. Sugar. It's the sugar that stimulates the release of insulin. So if you want to treat insulin resistance, you bring down the insulin level by prescribing. Yeah, my staff got a bit excited. By prescribing what? By prescribing a low-carb diet. How does a low-carb diet looks like? Okay, the picture that I'm sharing with you here is not what I plucked from the sky. It's not Google, it's not ChatGPT. This is my patients' private community group. This is what they share. Check out what my patients are eating. What is the first one there? It's a steak. It's a lamb steak to be specific. What is the second item there? Curry fish head. What is the third item there? It's steamboat. To reverse diabetes, we force our patients to eat food like this. Good or not? Our patients will never ever touch vegetable juice, protein shakes, none of those. Alright? To me, in fact, sorry to say, those are nonsense. My patients go for real good food like this, while bringing down their blood sugar. Okay? But of course, this alone is not enough. There's also another way to bring down your insulin level, which is by doing this. What is this? Sorry? Fasting, betul. Let's give her a big round of applause. Alright. So medically speaking, it's called intermittent fasting. So it's called intermittent fasting. So there's two models here. Alright. And I'm pretty sure most of us want to know a little bit more about the diet, right? How many of you want to know a little bit more? Tak banyak pun. Okay, then we wait for next year lah, kan? Hopefully Dr. So invite me again lah, right? Okay, alright. Okay, so now let's have some fun. Is that okay? No, actually fun for me, not fun for you lah. Stress for you. Yeah. Okay, we're gonna go into a quiz right now. Yeah, it's basically just raising your hand lah. That's all, as simple as that. I initially wanted to go for Slido, but we had some issues, so I end up just sharing the slides. Quiz time. Which rice do you think is the best when it comes to reversing diabetes? So every question that I'm asking here, by the way, only 3, okay? Only 3. Every question that I ask here is only pertaining to reversing diabetes, okay? So first question, which rice is the best when it comes to reversing diabetes? Maybe some of you want to try answering the question first before I reveal the options? Okay. So you don't mind walking over to the mic? There's one mic next to you. Thank you so much. Please introduce yourself and where do you practice and the answer. Alamak. Sorry, tech support. Thank you. Parboiled rice. All right, okay, thank you, thank you. Please give her a big round of applause. Parboiled rice. Okay. Anyone else wants to try?
No rice is best for the
No rice. No rice. Wow.
minimum pricing. Lowest price is the brown rice or the black one.
Okay, so no rice is the best, but it's okay to go for brown rice too. Oh, okay. All right. I like the answer. Very political. Yeah. Okay. Anyway, good try. So now let me review the answers to you first. Not really the answers, but some options. There are 4 answers here. Okay. So we just do a vote lah, huh? All right. How many of you think white rice is the best to reverse diabetes? Raise your hand. Okay, this one very obvious kan? Okay, I don't think anyone dares to even raise your hand, right? Okay, who say cauli rice is the best for to reverse diabetes? 1, 2, 3, 4, 5, 6, 7. Okay, got lah. 8. Okay lah. Okay, about 10 of you. 10 of you say cauli rice, huh? Next, brown rice. Who say brown rice is the best? Okay. Yeah, I think about 20 hands. Finally, what about basmati rice? Oh, basmati rice pun banyak, huh? So what is the answer? What is the answer? It's cauli rice. To reverse diabetes, we allow patients to eat cauli rice. Why? If you check out the nutrition label at the back of this rice bag, right, you will find that this white rice here, the A, option A, has got maybe about 60 to 70% carbohydrates. 60 to 70%. You don't take my word for it, you can go and check later, don't worry. Okay, that is for white rice. So that means every 100 gram, you will get about 60 to 70 grams of carbohydrates. Okay, so I know what you're thinking now. Brown rice and basmati rice, how much is the carbohydrates inside? Okay, we are scientific people, right? We are doctors, right? We are not some magician or whatever, right? We are scientific people. Let's look into the molecular structure of rice first. Okay, what is the difference between white rice and brown rice structurally? What's the difference? Harder, yes. There is one extra layer outside, right? Okay, so there's one extra layer outside, which is probably some fiber and some extra vitamins, minerals and things like that, right? What is inside? Is it the same? Brown rice is actually white rice wrapped with just another layer. So when it comes to the glucose content, it's exactly the same. Do you realize that no one ever take brown rice and successfully reversing their diabetes? Because the sugar level is the same. Okay, and I know what you're thinking about now. Doctor, you don't know meh? Glycemic index ma. I know. But low glycemic index itself is not enough to reverse diabetes. What do you need? You need glycemic load. LOAD. Write this down if this is the first time you hear about this term. What is the difference between these two? I'm going to use my hand as an example now. Let's say this hand of mine is white rice, and your sugar level is here. When you take white rice, your sugar will spike like this. Okay, there will be a sudden spike. Now, brown rice. Okay, we start off at the same level. If you take brown rice, what happens to your sugar level? Will it spike? Yes, it will spike. It will spike slowly. But sooner or later, it will reach the same level as the white rice. In terms of the content, it's the same. The glycemic load is the same. So, brown rice is not a low-carb food. It's only a slow carb, SLOW. Which is not good enough to help patients to reverse their diabetes. Alright? And basmati rice, to be fair, is actually almost the same as brown rice. That's all. Okay, now coming back to cauli rice. What is cauli rice? It's cauliflower rice. It's basically just cauliflower. You just blend it and you turn it into something like rice. That's all. What is the amount of carbohydrates inside? Can anyone tell me how much per 100 gram? Sorry? I saw someone doing like this. Yeah. 5. Did you say 5? 5. Betul, 5. Let's give a big round of applause. It's only 5 grams over 100 grams. Can you see the difference between them now? Alright. Okay, so I'm done with rice. Let's move on to the next item. Which milk is the best to reverse diabetes? Okay, this one I will display the answer first. Okay, diabetic milk. Many choices, right? Don't shout names, don't shout names. After I gonna throw eggs, you know. Yeah. Okay. How many of you feel that it's good to serve diabetic milk to the patient, diabetic patient? Huh? You don't sell, meh? Not you, then who? Pharmacists. Okay, I hope no pharmacists here today. Okay, anyway, okay, no diabetes. Okay, how many of you say low-fat milk is good for patients to reverse diabetes? No hands also. Okay. Then what about full cream milk? No hand also. Okay, so we have one last answer. I hope everyone raise your hand. Almond milk. Okay. So the rest of you don't know what is going on, right? Okay. So, okay, I know already. You all learned the trick already. Every time you see this kind of question, as long as you are not familiar with the answer, that's the answer, right? Yeah, okay. No wonder you are doctors, so smart. Okay, of course the answer is almond milk, because almond milk is basically from almond. Generally, to reverse diabetes, we don't advise patients to drink milk at all. Okay, except this almond milk. Okay, the rest of it is basically just cow's milk, right? We don't advise them to drink. Why? What is the chemical name of milk? Starts with L. Lactose. You know, right? A lot of people suffer from lactose intolerance. What is lactose? Sugar. Do you know that when we consume lactose, it is broken down into 2 parts. One of it is glucose and another one is galactose. Right? Basically the smallest structure in terms of the carbohydrates. So when you ask patients to drink milk, you are asking them to drink sugar. And the worst part is what, you know? If you ask them to drink low-fat milk, it's even worse. Because anytime you see a product that is labeled as low-fat, remember, they have forgotten to write the additional 2 words behind. Anything that is low-fat has to be high sugar, because fat makes the food delicious. You take out the fat, along with the fat, you take out all the fat-soluble vitamins like vitamin A, D, E, K and everything. Okay, you take out everything already, then you have to add sugar inside, which they don't write. Then they tell you fortified with vitamin D, fortified with calcium. But they are the one who took it out in the first place. Alright, so if you want to drink milk seriously, please go for full cream milk. I want to draw your attention to diabetic milk now. How many of you tried drinking diabetic milk before? You tried before? What is the taste? Manis. Why? Why is it manis? I tried once and I really got a shock of my life. It was so sweet that I cannot take it. I was like, what is this? Like, so sweet. I was like, is this made in Kelantan? Oh, sorry. Yeah. Okay, you all know Okay. It's sweet. If you check out the bottle, the nutrition fact of a diabetic milk, I'm not going to name you the brands. You go and find it out yourself. You all know one, alright? You will realize that most of the time, there will be at least 50% or more of sugar inside. Carbohydrates per se, carbohydrates. Not just sugar, but carbohydrates. Okay? Come, let's move on. Last one. Are you having fun so far? Oh, I thought I'm the only one having fun. Okay, but anyway. Alright, so to reverse diabetes, which one is the best? So we have a solid food just now, which is rice. We have a liquid just now, which is the milk. Now is additives. Okay, something you add into your food. Right, so which one is the best for patients? sweetener. Lakanto, xylitol, erythritol, all the to lah, huh? Okay. How many of you think, oh, this is good for the patient, let's prescribe this to the patient? Raise your hand. Tak ada. Okay. How many of you think brown sugar is good? Outside, I know. Alright? Yeah. How many say brown sugar is good to reverse diabetes? Okay, no. None. Okay. How many of you think none? Okay, alright. Okay, none. Last one. How many of you think pure honey is good for diabetics? Okay. So what is the answer? The answer is none lah. Not the naan, not the cheese naan. Wow, I want to go to Pak Putra after this. I miss their cheese naan. Hey, I study here, by the way. I graduated from Manipur, alright? Okay, so why sweetener is no good? I'm not sure whether you heard of this study before. They've done this study where they check on these people who drink a lot of Coke Zero. You know, right? Coke Zero is basically just sweetener. And they realized that those people who drink Coke Zero, they put on more weight compared to those who drink the classic Coke. Why? There's no sugar inside. Why they still put on weight? Because the sweetener, is sweetener sweet or not? Sweet, right? It's actually sweeter than sugar, right? You notice? When we taste the sweetness, right, it will trigger our brain to activate the pancreas to release insulin. Then insulin is a fat-making hormone. You notice most type 2 diabetics are overweight. They got too much insulin in them. That's why you notice type 1 diabetics are usually very lean, right? They macam mana makan pun takkan gemuk punya. They won't put on weight because they have lack of insulin. Because insulin is a fat-making hormone. So this sweetener causes a cerebral phase of activation of insulin release. That's why sweetener is no good. Brown sugar, the same theory as the white sugar just now, is literally the same. Pure honey. What is pure honey? I'm pretty sure you all know that white sugar is 50% glucose, 50% fructose, right? Do you know that pure honey has got more fructose than white sugar? More, not less, more. So, stop feeding sugar to your patients. By the way, honey is the vomiters of bees, you know. So I don't know why we want to spend so much money to take somebody's vomiters, okay? I never understand. But anyway, this is it. Alright, so the best is actually none. So our patients tend to drink only plain water, black coffee, and plain tea. That's all for the drinks. Yeah. Okay, so moving forward. How much more time I have? Oh, 10 minutes left. Okay, I want to be a little fast. You're looking for some evidence, right? Who is the one who inspired me to do what I'm doing now? Dr. Sarah Hobart. You want to write down? You can do some research on her later. Yep. By the way, she already passed on. I think 2 years ago. Yeah, 2 years ago. So of course, I'm very sad. Yeah. So you can see tons of research and everything from her. She was actually working in Virta Health. VIRTA. So you can search for this. You can easily find them online. So I just extracted this that was actually done by her. A 2-year clinical trial outcomes provide evidence for long-term benefits of Virta for type 2 diabetes. Let's go through the results right now. Okay. So of course, this is published in Frontiers, Frontiers in Endocrinology. Let's go through. Okay, so there's the blue bars are actually the Virta Health. Okay, so Virta Health means what they were doing? They were doing low-carb diet and intermittent fasting. They prescribed this to the patient. The black bars are the usual care. So you can see at baseline, this is those patients with diabetic medications, right? So 55.7 and 67.2. After 1 year, those who underwent Virta Health, the medications dropped by half. Dropped by half. While the other group continue to have more and more medications. It's usual, right? It's usual for diabetics to take more and more medications. So it's a common thing. Alright, so as you can see, at 2 years, it's 26.8. So it's about there. So it's actually dropping by half. This is for medication. This is OHAs. Next, for insulin. So when they started, this was the figure. Within 1 year, it dropped by half. That means the dosage of insulin dropped by half for the patients. And the last one, in 2 years' time, it went down to 15.5. While the usual care continued to increase in terms of dosage of insulin. It's common, right? Because the more insulin you give, the insulin resistance becomes worse, then you need more insulin for the patients. So this is normal. Next. Okay, what happens to the HbA1c? So you can see that the blue line, the HbA1c, despite dropping off the medications, reducing the dosage of insulin, the HbA1c dropped from 7.5 down to 6.2. Anyone wants to ask me why is it going up after this? It's going up, you know. That means it's worsening. Why? Because this one requires strict dietary intervention. And not everybody is as disciplined. So with less discipline, of course, the result will be worse. But anyway, still better than the usual care, right? Compared to the HbA1c. Alright? Let's move on. Okay, so other than just bringing down the HbA1c, what are the other positive outcomes that we see? Alright, let's go through. First one, body weight dropped by 12% overall. I'm pretty sure that you know in management of diabetes, bringing down the weight means a lot to the patient, right? But how do you bring down the weight when we are prescribing OHAs that stimulate the pancreas to release insulin? We are giving contradictory advice to the patient. Understand this part, alright? Next, insulin resistance, something that I'm very concerned about. Yeah? To calculate insulin resistance for the patient, you need to order the test called fasting insulin, fasting serum insulin, and you have to have the fasting blood sugar, put them together, you multiply the insulin and the fasting sugar and you divide by 22.5. That's how you get your HOMA IR. Alright, this insulin resistance. Okay, anyway, now everything can find on Google, ChatGPT, whatever. Go and search it. Next, metabolic syndrome rate go down by 29%. The CRP, which is the marker for acute inflammation, go down. White blood cells go down. Triglycerides, the bad guy, goes down. HDL goes up. Liver fibrosis, absence, this is absence, so it goes up. Suspected liver steatosis, also fatty liver, goes down. Fatty liver can be reversed as soon as 2 weeks. According to research, if you do the right thing for the patient, this steatosis can start improving within 3 days. Within 3 days. Alright? Okay, next. So you want to find all sorts of research, please go ahead. In Verta Health, there's tons of research there, okay, over the decades of research that is there. So please go ahead. Next. So these are, okay, so this is the combination of all the clinical outcomes. Peer-reviewed research evaluating the effect of Verta demonstrates that patients can safely improve health outcomes associated with type 2 diabetes, obesity, atherogenic of dyslipidemia, hypertension. The longest hypertension I've ever reversed is someone who suffered from it for 47 years. She was taking medication for 47 years and we reversed it and we switched off the medication for her. Alright, next, inflammation. So by impacting these chronic conditions, Verta improves several risk factors for type 2 diabetes and cardiovascular disease. Next. So the other one who inspired me to do what I do is Dr. Jason Fong. Please go and buy his book. I'm pretty sure you can afford it. It's less than 100 ringgit, The Diabetes Code. Read this because this is where I actually learned most of my, got most of my information. Alright, next. CPG. What is written in our latest CPG for diabetes? Okay. Recently, there is evidence that reversal or remission of T2DM may be possible in some individuals with short duration. I don't agree. The longest diabetes I have reversed suffer from it for 36 years. And we can still reverse it. Alright, next. Why does it move on its own just now? Okay, coming back. So following reversal of insulin resistance through significant and sustained weight loss by either caloric restriction or bariatric surgery. I don't do any surgery here, so it's only the caloric restriction part. Okay, next. A total diet replacement with weight loss of up to 15%, approximately 15 kg, can lead to diabetes remission. The fastest weight loss I've seen in my practice is 50 kg within 1 year, 50, without any supplements, no operation, nothing, 50 kg. So it can be done. Our own success story, okay, I don't have much time, so I can only share one basically. So this is my one case where he suffered from diabetes since 1984. When he saw me, it was year 2020. Alright, so these were the medication. You can see it's insulin, actrapid, insulatard, metformin, simvastatin, perindopril. I stopped everything in 6 months' time. Nowadays, I can do it faster because this was the beginning stage when I started focusing on diabetes reversal. So now it can be done sooner. Alright, so of course, he was interviewed by the papers for his success stories. Well, this is our Google reviews, 4.9 out of 5 stars. If you Google search, you will see how our patients explain how their lives are transformed. And of course, we received the Global Health Awards, which is all these hospitals gotten it before. For us, we got the category of Reverse Diabetes Center of the Year in Asia Pacific. Question.
Do you have any questions on the floor?
Yes. Yeah.
Thank you, Dr. Andrew, for the very interesting talk. I'm Dr. Donald, GP in Blackburn. I was just wondering, what about fruits? Fruits, you never in touch on fruits. Can you say something about it? Maybe.
Yes. Fruits is a candy from God. So it is still a candy. Fruits generally contain a lot of fructose. So sometimes when you take fruits, you notice that your blood glucose may not go up because the blood measures glucose, not fructose. When we consume fructose, 10% to 20% of it goes to the brain. That's why sometimes you get that high if you drink too much Coke. The remaining 80% will go to your liver. And in your liver, the fructose is converted to fats. I just gave you a hint. One of the main cause of fatty liver is actually fruits. Yeah. So to reverse fatty liver, once you cut the carbohydrates intake of the patient, the fatty liver can just reverse like this. Yeah. So fruits is actually quite bad as well. Especially fruit juices. That's even worse. Because you cut off the fiber and everything, it's like no matter how hungry you are, you cannot eat 3 apples. But you can drink 3 apples. So that's the difference. Yeah. So fruit is not as good as we think. Yeah. And fruits, right? You know, in the past, when God created fruits, when are we supposed to consume fruits? There's actually a season for it. Fruits usually drop off from the trees during which season? Starts with A. Autumn. You know why is it autumn? Autumn, when the fruits drop off, you consume, your body is accumulating. You accumulate, and then during winter, your body gets to burn off all this. And then the cycle starts again. Nowadays, we don't have that opportunity to burn. We just keep eating. Durian, 24/7 throughout. And then now some are getting cheaper, right? Yeah. So fruit is not as good as we think. Alright. Okay, thank you so much for the question. Any more questions? Alright, we have one. Yeah, sorry.
Hi, Doctor. I'm Doctor from Jesse.
Alright, hi.
And can I ask how do you persuade your patient to follow your dietary plan?
How do I persuade my patients?
Because we know that most diabetic patients cannot control their urge to eat.
Okay. I charge them a lot. No, to be fair, if it's free advice, nobody will listen. I mean, this is the truth. People take things for granted. People take free things for granted. So they won't listen. You have to really charge. But you have to really give them enough value. Okay? So the easiest way is to scare them. How do I scare them? Okay. This is important. We all know that we prescribe medications and insulin to patients to prevent complications, right? Do they prevent complications? How many of you think that no, it doesn't really prevent complications? It doesn't really prevent. Do you know why? I can show you all the research. It's called a ACCORD study. Write this down. ACCORD. It proves to you that the OHAs and the insulin not only do not prevent complications, it actually draw you closer to your complications. I'm not joking when I say this. You all know very well, patients who are very disciplined in taking medications, they still end up with complications. A stroke, a heart attack, a kidney failure, whatever you name it, numbness, amputation. It never prevent the complications. So I share this with them, telling them that and patients already know, they themselves know. So in the end, they decide, okay, I want to come on board. So when they come on board, they sign up our program. We have a program for it. And then with that program, we guide them step by step. I help them to switch off their medication. I will guide them on the food. I will tell them exactly what to eat, what not to eat, when to eat, because we are doing intermittent fasting also. Yeah. So in the end, patients have to convince themselves. We are sharing only the knowledge. They decide for themselves whether they want to take medications for the rest of their life and wait for complications to hit them, or they want to reverse it and be healthy once again. It's not easy, I understand. Thank you so much for the questions. Yeah.
I'm afraid that will be
Okay.
the last question.
Yeah, alright, yes. Can I wrap it up? I got just a few more. Okay, so finally, coming back to this. Okay. Can I move the slides? Sorry, I need to move the slides. Next. No, it's not moving. Okay. So who am I? I want to consider myself as a reversing diabetes doctor who treats the root cause of diabetes by removing their medications, insulin, and supplements. And I do this via education, not medication. Right? So this is my TikTok account. I have 123,000 followers so far. You can scan, you can follow. I share quite a bit about diabetes reversal here. And for those of you who are interested for more information, you want collaborations or referral anything, please visit our booth outside. Okay? So I want to wrap this up with the last quote from our father of modern medicine, Sir William Osler. This is what he said. One of the first duties of physician is to educate the masses, not to take medicine. Thank you.
Thank you, Dr. Andrew. I would just like to call upon Dato' Dr. S. Maduraga, Treasurer of MMA Melaka, to present a token of appreciation.
Thanks a lot, Lagut.
Thank you.
Thanks, huh?
Yeah, appreciate
Okay. I think your staff is taking.
it. Yeah.
Okay. Thanks.
Thank
a
you.
lot. Thanks.
Thank you again, Dr. Andrew and Dr. Biden.
Thanks, bro.
Up next, we have Dr. Adam Al-Anas bin Mahali, a consultant